Today we're introducing Dr. Dahliwahl, Medical Director and Primary Care Physician here at Sunstate Doctors Medical Group. Thank you, Dr. Dahliwahl, for joining us.
Thank you for having me.
Could you give us a little bit about your background and what led you to become a primary care physician?
So I'm board certified in family medicine. I completed my residency at West Virginia University in 2012, and I started my practice, Tampa Bay Family Physicians, in Sun City Center. And that's the beginning of Sunstate Doctors.
What do you enjoy most about being a primary care physician?
I enjoy being a part of the lives of my patients. As a primary care provider, I get to see my patient through their entire lifespan. I get to know their family, I get to see their friends, I get to be a part of the community. I value doctor-patient relationship, and I enjoy being a primary care provider.
How would you describe your approach to patient care?
My approach to patient care is based on the fact that we can change healthcare outcomes if patients are actively engaged and involved. So I believe in partnering with my patients so they are able to equally participate in their healthcare.
And what can patients expect with you during their first visit?
First visit, I get to know their medical issues, their medications, surgeries they've had, any hospitalizations, any barriers to their care. I go over their past medical records. I get to see what screenings they've completed, any previous lab results. I also like to understand their healthcare goals and advanced directives. At the first visit, we formulate a care plan together, and the most important thing, I always let them know how they can reach me, because it's very important that patients realize as their primary care provider, I'm available to them if they need me.
And how would you describe your approach to patient care?
My approach to patient care is a holistic approach where I get to know my patient well, I get to understand their medical issues and their limitations to care, their barriers to care. I get to understand their healthcare goals, what is important to them, and how we can work together to make a change.
What advice would you give to someone looking to improve their overall health?
I believe that our body is a vehicle that carries us through this journey of life, and physical and mental well-being is really important to our quality of life. So I tell my patients, take ownership of your healthcare. Make sure that you're eating a balanced diet, getting good sleep, following your primary care visits, getting a little bit of physical activity every day, and a good sleep. I think preventive care is a really important part of this, and so encouraging them to have a primary care provider and keep their regular checkups is key.
Well, thank you so much, Dr. Dahliwahl. It was great getting to know you.
Thank you for having me.